Good afternoon, everyone, and welcome to the February Budget and Fiscal Advisory Committee meeting. My name is Al Rolat, and I have the privilege of serving as chair of this committee. Again, we are deeply committed to fiscal transparency and accountability. Today, we will review the Commission's financial position at the midpoint of the fiscal year 2025-2026 and explore financing strengths and alternative funding models to support stability and sustainability of behavioral health services. I look forward to a productive discussion as we work together to strengthen our fiscal practices. Before we take roll, and I don't see Vice Chair. There you are, Vice Chair. Vice Chair, I'd like to ask Vice Chair Contreras to please share some opening remarks.
Thank you, Chair Roulette. Happy to be here. I have just more of a logistical announcement, which is that I will have to step away halfway through the meeting a little bit early today, but we'll ensure that we have quorum. So thank you.
Please note, now that we are going to take roll and establish quorum, that under Bagley-Keene Open Meeting Act, any commissioners who are participating remotely must keep their cameras on at all times and will be asked during roll call to disclose if they have any adults over the age of 18 in the room with them during the meeting and the nature of their relationship with these individuals. Sandra, please take roll.
Thank you. Commissioners participating online, please unmute your line at this time and remember to disclose if anyone over the age of 18 is in the room with you. Commissioner Bunch, marking absent. Commissioner Carnevale.
Here.
Commissioner Gordon.
Here.
Commissioner Designee Pulmano.
Here, no one is in the room with me.
Thank you. Commissioner Wilkes.
Here, and no one is in the room with me.
Thank you. Commissioner Contreras.
Here, no one's in the room with me as well.
Thank you. Commissioner Roulette.
Here.
We have established quorum.
Thank you. And before we begin, I just want to acknowledge to those who are attending our meeting online virtually. I'm having a little bit of an eye issue, and so our executive director is going to assist me today. If I miss your hand going up, please be patient, as our executive director will make sure that everyone gets recognized and I don't omit anyone. It is not intended, it's just I'm having a bit of an eye issue today. Maybe it's the weather, the wonderful weather that we're having. Okay. Before we begin, again, I want to remind everyone that we will be abiding by Bagley-Keene laws for these meetings. As part of our committees, deeper public involvement in open governance and all advisory committees meetings include an enhanced public comment segment designed to promote genuine dialogue. Cody, if you could please go to the announcement side. All right. Thank you very much. Next, we will continue to provide brief updates on recent contracts and amendments approved under the Executive Director's authority. These updates are shared during all committee announcements for informational purposes only. As a reminder, all contracts and amendments are negotiated between the Commission and the contractor and must be mutually agreed upon. This month, we have 6 proposed agreements to translate the new Behavioral Health Services Act planning process toolkit into multiple language. The details of each agreement are as follows. And I will certainly ask our executive director if she wants to add anything after I'm done. That would be great. First, we have an agreement in the amount of $4,539 with American Language Services to translate the BHSA toolkit into Korean and Khmer. Next, an agreement for $2,450 with Refugee Enrichment and Development Association. Thatcher, I'm going to say that again. Next, an agreement for $2,450 with Refugee Enrichment and Development Association, Thatcher, to translate the toolkit into Arabic. Third, an agreement for $1,680 with Refugee Enrichment and Development Association, Alamir, to provide translation into Farsi. Fourth, we have an agreement for $953.10 with Gigi Perry to translate the toolkit into Spanish. Fifth, an agreement for $8,240 with Equity Languages and Employment Services to translate the BHSA toolkit into Cantonese, Mandarin, and Tagalog. Finally, an agreement for $4,200 with Bolt People SOS to translate the toolkit into Vietnamese. This concludes this month's amendments and updates, unless our executive director would like to make some comments.
No, I can just say a big thank you to our team and all of the stakeholders who have helped us. This is for our BHSA stakeholder toolkit for the community planning process. So I know there's been a lot of hard work. We were able to launch the toolkit just within the last week or so, and one of the pieces of feedback that we'd received from stakeholders was to do these translations. So even though these are small dollar amounts, wanted to definitely put a nod out to everybody for all the help and work and helping us shape this.
Maybe a small dollar amount, but tremendous impact overall. Thank you. Cody, please go to the committee highlights slide. Thank you, Cody. To support this effort, we will take a moment to review key updates and highlights from the other 4 committees. By sharing these highlights, our goal is to keep everyone aligned, streamline communication, and foster a more connected approach to our work. The Program Advisory Committee received a presentation from the Department of Health Care Services on performance measures for the Behavioral Health Services Act, and also heard a presentation by staff on its data framework, thus highlighting efforts to align and improve data-driven decision-making. The Legislative and External Affairs Advisory Committee will meet and consider bills that the Commission may choose to support or oppose in the 2026 legislative session. They also provided an update on the Early Psychosis Intervention, EPI, video project, which focuses on promoting coordinated specialty care for EPI. On February 24th, the Workplace Optimization Advisory Committee will hold a closed session and hear from Human Resources regarding workplace wellness matters. Finally, on February 26th, the Client, Family, and Community Inclusion Lived Experience and Diversity Advisory Committee will have a focused discussion about the effect of BHSA implementation on peers and peer-run organizations. The committee will also discuss its future structure, exploring ways to strengthen inclusion and representation moving forward. Thank you very much for giving us your attention on that. Now, Cody, if you could please go to the grants and contract expenditure slide, a list slide. Okay. The grants and contractors expenditure list has been updated as of February 8th, 2026, and can be found in today's meeting materials packet. It's there available for everyone. And on the Commission's website, and a hyperlink is included in the slides posted online. Please note the Commission has terminated Agreement 22 MHS-OAC 022 with the University of Pacific, originally in the amount of $5 million. As a result, the agreement no longer appears on the grants and contractors expenditure list. All the remaining funds associated with this agreement will revert to the Behavioral Health Services Fund. Lastly, the full commission is scheduled to hold the next meeting, and thank you all commissioners who are at the meeting today. I really appreciate this. It is a 2-day meeting on March 26 and 27, and most importantly, thank you to the staff for its heroic efforts in bringing this together. I know this is not easy. Thank you, commission staff, very much. Looking forward to a very important meeting on March 26th and 27th. That concludes the announcements for this afternoon. Again, I want to welcome everyone to today's meeting. It's now time for agenda item 3, general public comment. This time is reserved for comments on items that are not on the agenda. Cody, please lead us into public comment.
Thank you, Chair. If you'd like a live meeting transcription or closed captioning, please activate the closed captioning feature located in the control bar at the top or bottom of your screen. If there are any members of the public using translation technology, please notify the chair so we can be mindful. You may request to make public comment by submitting a card in the room, clicking the raise hand icon on your computer or the app, or if calling in by phone, push *9. Members of the public can also email us public comment to be shared at a future meeting at publiccomment@bhsoac.ca.gov. I'll now go over the public comment procedures. For members of the public in the room, if you have not already, please use one of the orange public comment cards located at the front to indicate you would like to make comment on this item and any other agenda items. Cards can be given to staff located at the table. When it is your turn to comment, I will call you to the podium or unmute your line and announce your name or the last 3 digits of your telephone number. We truly appreciate your understanding with the process. I don't believe we have any in-room comments unless they haven't made it back here to me yet, so we're going to go to virtual comments. We currently just have one virtual comment. Laurel, go ahead and unmute your line.
Good morning. I'm Laurel Ben Hamida with Mass Social Services Foundation and REMCO, the Reducing Mental Health Disparities Coalition. I just want to say thank you and commend you for the translations that you have commissioned of the toolkit. I also like to see small businesses used who have vetted translators, and it looks like you did that. And so that is a big step forward. Thank you.
Thank you, Laurel. And at this time, that is all of the public comment. Back to you.
Thank you, Laurel, and thank you, Cody. The committee will now move to agenda item 4 and consider approval of the minutes from the December 16th, 2025 Budget and Fiscal Advisory Committee. At this time, I'd like to invite commissioners to offer comments or ask questions. Seeing no hands or no comments in the room. Cody, please go ahead to public comment.
Okay, at this time, members of the public may request to make a public comment on this item. As of now, I do not see any public comment. So back to you.
Okay, thank you. All right, thank you, Cody. Before we entertain a motion, I'll ask all commissioners, both online and in person, to unmute your lines. Now I will entertain a motion to approve the minutes from our December 16th, 2025 Budget and Fiscal Advisory Committee meeting.
Omano moves.
Wilk second.
So Pomano moves, and who second? Wilkes second? Perfect, thank you. We have a motion on the floor for the Budget and Fiscal Advisory Committee to approve the December 16th, 2025 meeting minutes with a motion and a second. Commissioner Bunch, marking absent. Commissioner Carnevale.
Yes.
Commissioner Gordon.
Aye.
Commissioner Designee Pomano.
Aye.
Commissioner Wilkes.
Aye.
Commissioner Contreras.
Aye.
Commissioner Roulette.
Aye.
The motion passes.
Thank you. We will now move on to agenda item 5, Commission's mid-year budget update for fiscal year 25-26. I am pleased to welcome the now very famous and important Lauren Quintera, Acting Deputy Director, who is doing a marvelous job. Lauren, thank you so much. The Acting Deputy Director of Administration and Performance Management, to provide an overview of the Commission's financial position at the midpoint of the fiscal year. Thank you, Lauren.
Thank you. Good afternoon, everyone. As Chair Roulette said, I'm Lauren Quintero, Acting Deputy Director for Administration and Performance Management. Today, I'll be walking you through the Commission's mid-year budget update for fiscal year 2025-26. Let's get started. To ground us, I'll begin with California's budget process timeline. This first slide shows the California budget process. The process begins with the governor's proposed budget, which is released on January 10th each year. From there, the legislature reviews and revises the proposal through hearings and negotiations. The governor then releases the May revision on May 14th, leaving about a month for each budget committee to adopt a budget and for the budget conference committee to resolve differences. The final budget must be approved by both houses by June 15th and signed by the governor by June 30th. The new fiscal year begins on July 1st. Throughout this process, the Commission can request budget changes through the Department of Finance or by working directly with the legislature to discuss new initiatives, program needs, and supports. So mid-year is because even though it's the beginning of this calendar year, it's mid-year in the fiscal year. So each year, the governor's budget allocates funding to the commission in two broad categories: state operations and local assistance. Today, I'll start with state operations, which includes personnel, operating expenses, and the commission's budget-directed items. For personnel, the budget at the beginning of the fiscal year was $9,507,000. The mid-year adjustment brings it to $9,735,000. This net increase of $228,000 reflects several allocation changes. Allocation for employee benefits went up by $36,000. Allocation for other post-employment benefits was reduced by $148,000. Allocation for staff benefits increased by $39,000. And Section 3.60 pension contribution adjustment increased or added an additional $301,000. Section 4.12, vacancy savings and position elimination adjustment, which did decrease that category by $385,000. That was reflected at the beginning of the budget year, and it is shown again at this mid-year budget update, just for reference. It is very common to see mid-year adjustments in the personnel category that reflect bargaining unit negotiated changes as well as other state mandated adjustments. For operations, non-personnel, the budget is $2,970,000, which is unchanged at this mid-year update. However, we do want to note the effect of the 7.95% reduction to operations funding that impacted all state agencies under Section 4.05, Government Efficiencies Reductions. That reduction began in fiscal year 24-25 and continues going forward. Within that reduction, administration and performance management was adjusted down from $2,454,845 to $1,761,542. Legislative and external affairs goes from $308,400 to $221,301. Research, evaluation, and program goes from $1,160,500 to $832,749. And legal goes from $155,255 to $111,408 at mid-year. The total amount of reductions from Section 4.05, Government Efficiencies Reductions, is $1,152,000, which we proportionally reduced each of those four categories to accommodate that amount. Under budget-directed items, we have $500,000. $400,000 of that is for full-service partnership evaluations, and $100,000 is for Proposition 1 implementation. These figures remain unchanged in the mid-year adjustment. Altogether, total state operations moves from $12,934,000 to $13,162 at mid-year. As I dive into our financial position at mid-fiscal year 2025-26, I want to start by explaining the columns you'll see on this and the following tables in the presentation. The first column, mid-year budget 2025-26, reflects the budgeted amount for each subcategory in the state operations portion of the budget. as adjusted at mid-year based on the changes I explained on the previous slide. The next column, year-to-date expenditures, shows the money that has already been spent, meaning the check has been issued. Remaining encumbrance represents funds tied to a signed and valid contract between the Commission and another entity. For example, if we had a contract for $5 million and we've spent $1 million so far, the remaining encumbrance would be $4 million, and that amount would appear in this column. Designated column reflects two things. First, contracts that the Commission has approved for procurement or award, but have not yet been executed, so the funds are not yet officially encumbered. And second, expenses that are not tied to a Commission contract, but are still expected, such as monthly rent or staff salaries. Estimated total combines year-to-date expenses, remaining encumbrance, and designated funds to project the likely total when the fiscal year closes. Finally, variance shows the difference between the mid-year budget amount and the estimated total. Now that we've covered the definitions, let's look at the numbers. For personnel, wages, and benefits, the mid-year budget is $9,735,000. Year-to-date expenses are $4,560,227. There is no remaining encumbrance since staff salaries and benefits are not an encumberable expense. Designated funds total $4,155,000. That gives us an estimated total of $8,715,227, which means we are projecting a positive variance of $1,019,773 in the personnel category. For operations, the mid-year budget is $2,927,000. Year-to-date expenses are $1,326,503. The remaining encumbrance is $756,151. Designated funds total $1,408,157. That brings the estimated total to $3,490,811, resulting in a negative variance of $563,811. Breaking operations down further, administration and performance management has a mid-year budget of $1,761,542. Year-to-date expenses are $1,114,565. Funds that are still encumbered, $552,146. Designated funds total $619,080. The estimated total expenditures are $2,285,791, with a negative variance projected of $524,249. Legislative and External Affairs has a mid-year budget of $221,301. Year-to-date expenses are $34,021. Encumbered amount is $18,210. Designated funds total $87,500. So the estimated total is $139,731, leaving a positive variance of $81,570. Research, Evaluation, and Programs has a mid-year budget of $832,749. Year-to-date expenses are $135,591. Encumbrance is $183,200. Designated funds total $572,527, which makes the estimated total $891,318, with a negative variance of $58,569. Legal category has a mid-year budget of $111,408. Year-to-date expenses are $42,326. Current remaining encumbrance is $2,595. Designated funds total $129,050. The estimated total is $173,971, with a negative variance of $62,563. For budget-directed items, the total is $500,000. Year-to-date expenses are $0. Encumbrance is $95,000. Designated funds total $400,000. The estimated total is $495,000, leaving a positive variance of $5,000. Within that category, we have the full service partnership evaluations. All of that money is designated, the entire $400,000. For Proposition 1 implementation, the budget is $100,000. We have $95,000 encumbered, and so that makes an estimated total of $95,000, leaving a positive variance of $5,000. So altogether for fiscal year 2025-26 across all these categories, the mid-year budget is $13,162,000. Year-to-date expenses are $5,886,730. The remaining encumbrances to date, $851,151. Designated funds total $5,963,157. The estimated total is $12,701,038, leaving an overall positive variance projected of $460,962. Now, even though we are currently estimating a positive variance of $460,962 at the end of the fiscal year based on the projections, I do want to add a few caveats. First, we typically hold aside between $175,000 to $225,000 for late arriving charges from control agencies. For example, the California State Payroll System Project is determining fees for state agencies and may begin billing and potentially back billing departments soon. We can receive bills for up to 2 years after the fiscal year closes, so we reserve funds to avoid paying prior year expenses out of future year funds. Second, the negative variance in operations reflects a strategic reallocation of salary savings, not overspending. We closely monitor expenditures and use salary savings for timely contracts, such as the contract we recently entered into for the update for the strategic plan, or the language translation agreements that we discussed during announcements today. I want to stress that contracts will continue to either be listed on our announcement slides, as the language ones were today, or presented for official expenditure authorization to this committee and the full commission. This pie chart reflects the year-to-date column from the previous slide. It is designed to visually represent the categories of expenditure and the percentage each category contributes to the Commission's overall state operations spending. So as you can see, salary accounts for 51%, benefits 26%, facilities, which includes rent, lease management fees, security, and furniture, accounts for 10%, IT, which is hardware, software, communications equipment, website, and some data storage related costs, 6%. Procurement support takes up 2%, supplies and goods 2%, travel and meeting expenses such as hotel, airfare, food, taxi, and transcription services, 1%, legal, which includes DOJ fees and notary fees, 1%, and then other miscellaneous category is random interagency services and consulting, 1%. Moving to the annual local assistance allocations for fiscal year 2025-26. For the Mental Health Wellness Act, the budget is $20 million. Year-to-date expenses are $0. Remaining encumbrance is $4,581,223, and the designated funds total $15,418,777. The estimated total, all $20 million spent. For the Behavioral Health Student Services Act, the budget is $7,606,000. Year-to-date expenses are $248,747. Remaining encumbrance is $7,357,253. Designated funds are $0, and the estimated total is all of it spent, $7,606,000. For community advocacy, the budget is $6,700,000. Year-to-date expenses are $25,000. Remaining encumbrance is $6,005,000. Designated funds total $670,000. So the estimated total is that all of this money will be spent and encumbered by the end of the year. So altogether, local assistance reflects a budget of $34,306,000. Year-to-date expenses are $273,747. We have a remaining encumbrance of $17,943,476. Designated funds are $16,088,777, with an estimated total that all of the money will be accounted for, spent, encumbered, $34,360,000. $306,000 by the end of the year. A couple of notes on timing and scope. For the Mental Health Wellness Act, the amount reflected in the designated column, it includes the 0 to 5 maternal behavioral health technical assistance contract awarded to the Public Health Institute, which was part of the consent agenda item at the January 22nd full commission meeting. It also includes the full service partnership performance management technical assistance contract awarded to third sector capital partners, which was also part of the consent item at the January 26th full commission meeting. Also included is the upcoming peer respite competitive procurement, which is expected to be released in late March 2026. For community advocacy, the designated amount includes funds to be awarded through the Transition Age Youth Advocacy Competitive Procurement, which is currently in process right now, with the awardee currently being anticipated to be announced at the March 2026 Commission meeting. So this slide summarizes other active local assistance funds from prior fiscal years. For Mental Health Wellness Act 2024, the budget is $20 million. Year-to-date expenses are $0. Remaining encumbrance is $13,816,500. Designated funds total $6,183,500, and the estimated total is $20 million. For older adults reappropriation for fiscal year 2021-22, the budget is $995,301. Year-to-date expenses are $0. Remaining encumbrance is $459,966. Designated funds total $273,897. Estimated total is $733,863, with a positive variance expected of $261,438. For BHSSA fiscal year 2021 to 22, the budget is $180 million. Year-to-date expenses are $385,584. Remaining encumbrance of those funds is $53,614,416, and the estimated total at the end is that all $180,000 will be spent. For BHSSA admin, fiscal year 2021-22, the budget is $25 million. Year-to-date expenses are $6,780,160. The remaining encumbrance is $6,451,808. We have $11,768,032 designated, and the estimated total is for the full amount of $25 million at the end of this encumbrance period. For Behavioral Health Student Services Act evaluation fiscal year 2022-23 funds, the budget is $16,646,000. Year-to-date expenses are $1,711,232. Remaining encumbrance is $3,990,000. Designated funds are $10,944,768. And we do have an estimated total of the $16,646,000 being spent or encumbered. So altogether, total prior year's active funds reflect a budget of $242,641,301. Year-to-date expenses are $134,876,976. We have a remaining encumbrance of $78,332,690. Designated funds for the designated funds, we have $29,170,197, and we have an estimated total of $242,379,863, with a positive variance of $261,438. I have 4 clarifying notes on this slide. First, the Mental Health Wellness Act fiscal year 2024 designated amount, like the previous slide, includes the 0 to 5 maternal behavioral health technical assistance contract with the Public Health Institute and the FSP performance management technical assistance contract with third sector capital partners. We fund those, as we do many of our agreements, out of more than one fiscal year so that the life of the contract is longer. Second, BHSSA, Behavioral Health Student Services Act Administration Fund designated amount includes support for limited term positions through June 30th, 2028, grant management software, technical assistance for suicide prevention training, and substance use disorder integration pilots as approved at the January 22nd, 2026 Commission meeting. Third, Behavioral Health Student Services Act Evaluation Fund designated amounts include limited term positions through June 30th, 2028, and school behavioral health performance management systems to be awarded via competitive procurement, which is expected to go out in April 2026, to be awarded in April 2026, and that was also approved at the January 22nd, 2026 Commission meeting. Finally, the Older Adults Mental Health Wellness Act project is going to sunset on June 30th, 2026. Funds have already been added to grantees who requested additional dollars to complete their scopes of work under the grant. Timing constraints for approvals and redistribution of funds preclude any further use of these funds. So that concludes the mid-year budget update. Thank you for your time and attention. I want to remind anyone watching that this presentation today that you can always email budget@bhsoac.ca.gov with questions, ideas, or feedback. I'm now going to turn it back to Chair Roulette for Commissioner questions, ideas, and feedback.
As stated by Lauren, if there are questions by commissioners in the room or commissioners online, this is your time. Steve.
Thanks, Lauren, for the specificity. Just a quick question. Since we don't really get a balance sheet, you mentioned that there are reserves that you keep each year for, possible encumbrances several years later. Is there like a rolling account? How much is in that account that has rolled forward over time?
I don't have one for you today, but we do keep track as we get the bills after. The commission hasn't been interested for those numbers usually after the year has passed, but that's something that we can show.
I was just curious whether we sort of, whether there's some huge number sitting there that we've kept or whether it's kind of balances out or how that works.
It usually balances out, just from my estimation. It's not just control agencies that late bill, although that is the primary thing that hits us, but it could even be travel expense claims from previous years, and they all get submitted in a big package. We bill those out of the years that they occur. There can be a variety of stuff. Sometimes a contract did the work during the thing, the bill got lost, we end up straight paying out of the previous year that the contract did hit. That doesn't happen as much anymore, but just as past years, that's been something.
And I guess that money, it's not like if we have extra, it comes back to us. I presume it rolls back into the treasury. Is that
Yeah,
right?
once it's passed, so the operations funds, which is going to be the typical timeline for almost any kind of encumbrance, we have 1 year to spend or encumber. After that year, if it's not encumbered and we don't have a late coming expense to straight pay, we can't use it for anything else.
Yeah,
has
but
to be first,
the incentive to make sure you have enough as it hits your current budget.
That's
if you
right.
don't.
So if we were to run out of funds in the past year, we would have to either hit our current budget or go to government claims, which we have never had to do since I've been here, and I don't want to. I worked there a long time ago, and you don't want to have to go and beg for more money.
Thank you.
You going to say something?
Oh, I was just going to say, just to clarify, there's the two pieces of it. One is the contracts that we have that spend down, and so they kind of stagger the allocations to make sure that the contractors have enough time to do the work, and then that's all encumbered, and that money's all in contracts. And then the second piece is, I think, what Lauren was talking about, where it's like our spend down, and we had about 400,000, but we're wanting to save it for all
some
those
of it,
extra
yeah.
bills that roll in at the end of the fiscal.
Any additional Yes, Commissioner Ross Palmano.
Hi, thank you. Thank you again, Lauren, for the presentation. A couple of things. What are the differences with slide 12? You have allocation for employee benefits, allocation for other post-employment benefits, allocation for staff benefits. What are these things? What are the differences?
Oh, So the adjustments came straight from the governor's budget. And so, like, normally at the top of the year, we are just gonna, at the beginning of a fiscal year, we would just show you salary or benefits. But when they adjust it mid-year, each adjustment in the governor's budget has a line item. So I wanted to reflect it here. If you want to know, like, specifically the other OPEB benefits, that's tied to something
And what does
that
that acronym mean again?
other post-employment benefits. It's something that if you work for the state, you pay a percentage. It has to do with retirement savings. You pay a percentage right now, and the state matches it, right? So it's usually like we each pay a certain percentage. Right now, for I think all of the bargaining units, that is suspended. They gave us a 1-day furlough and reduced our salaries, but they suspended our contribution to those benefits. So take-home pay for most people did not change significantly. So they kind of aren't putting that extra money.
Even out. Got it. Yeah.
Yeah. So it's things like that mostly. And then the other stuff, if during the beginning of the fiscal year, which happens often, a bargaining unit negotiates for something, it gets signed. Typically, it will affect the beginning of the fiscal year, even though it happens later. So it can make little adjustments to salary or benefits depending on what's negotiated.
Yeah. So when we talk about employee benefits and staff benefits, those are just related to coding. Is that what you're saying?
Yeah.
That the administration began requiring agencies to institute. So my question is, where would your health benefits be, for example? Because I know that there has been a rise in, for example, the cost share on premiums and all that stuff. Are they under the employee benefits or staff
It's just
benefits?
under employee benefits, and I actually could at any time, if anybody's interested, I can, because of the way that the state codes things, I could pull out if you just want to know, because benefits, when you see that, it includes co-ben for certain employees, otherwise health, dental, vision, each coded separately. So if you really just wanted to know health benefits, I could get you that number.
No, it's fine. I was just trying to make sense of the differences between these two different words. They seem to all be benefits, but for some reason, they have been subdivided into two things.
Yeah, and I use them. So just informally, we call it staff benefits, but the official way that it's worded in the governor's budget is the employment. So I'm sorry if that was confusing. I'll make sure that we standardize that in the future just so that it doesn't sound like it's two separate things.
So allocation of staff benefits is for purposes of employment?
Just all the benefits that they get as an employee. So health, dental, vision, life insurance for some, transit subsidies. It just all gets lumped into that category.
Okay. I think I can ask my other question next time. I let's get back to, you gave us a very robust overview of all the funding. And then we got a copy of the grants and contracts expenditure list. And I think what stood out for me was the percentages on progress. Okay. So for example, and I'm gonna go through just the things that I highlighted. Like, should we be concerned about this? And if so, which one should we be concerned about? For the community advocacy, you have K to 12, the Jakara movement, they're at 31% on progress. Okay. All of the advocacy for the immigrant and refugee, their progress is all at 0%, except the Youth Leadership Institute that had, done 10%. Okay. And then again, on the Advocacy 2025, I suppose there's a little bit of time for those, right? Because we just started them. So I'm not going to raise too much on that one. And then what's going on with Mendocino County, where they are at 46% on the BHSSA. And then on the round 2, curious about Shasta, they are at 40%. And then on round 3, Kings, they are at 38%. And then on all the administration, they are all below 50%. I know that I think that EOP at 0% because we just suspended that. So what's going on with those that are under 50? And then the counties, round 4, oh, then I think West Eddie's evaluation. And then round 4, a lot of these counties are at, 33% and below, and some of them are at 0%. And then I'm just going to go through them. And then the Mental Health Wellness Act, Sutter Coast is at 42%. Um, Empath, very low progress. Um, SUD grants, not too much concern, but just curious what's going on with Marin, Nevada County. And also, yeah, let's see here, the maternal behavioral health in children ages 0 to 5. I think there's time for that, so that progress is still ongoing. I don't have problems with that. So what is going on with these grants?
If I could also, before Lauren, Commissioner Palmano asked the great question. And so what I would also propose is at our next BFA meeting, we get a more comprehensive update on the progress associated with these expenditures or the reason for the lack of progress around some of these expenditures. And I know that some of this has just started because I get a little bit of a budget overview in my preparation for the meeting, but I'm going to now go back to you to be able to answer some of the questions, but I know a deep dive will require more data and information, and I'm hoping that we can get that at the next meeting. Great questions, Commissioner.
Commissioner, if you think it is more appropriate to actually wait on until we get into that deep dive, I'm open to that. I just, I've already highlighted my questions, and so I can wait.
I think your questions are great questions, and so, Lauren, can you provide us with the data associated with a deeper dive around those questions?
Some I know today, but as much as I want to know every single thing about every program, we have contract managers that have the more in-depth ones, and even if I did know, I couldn't possibly memorize them. I do know that for Shasta Round 2, they are actually had some kind of problem with their program and will be returning funds. So I don't expect that they will spend all of that. And that's still being worked out with the program. So, and Jakara was on a different timeline. That was the first one you mentioned than the other ones. I think they were late starting. We had some money awarded and then we had a little bit left over. And so Jakara got it. They were at a later schedule, if my memory serves me correctly. For the 0 to 5, those ones just started. And overall, this is just going to be a blanket caveat. Mental Health Wellness Act funds, unlike most other normal categories that we would be awarded, have 2 years to encumber and then additional 2 years to spend. They just have a longer life, which means we might have funds from 2024, but the contract may have not been encumbered until sometime within 2025. So sometimes the slow spending isn't really slow spending. It's just that the money took longer to be awarded through whatever reason, and the whole payment schedule is that. So, I mean, overall, we rely on the program team to be working closely when the county is encountering challenges with the timely spending of the money. So sometimes the schedule's just built in to the contract, that it's not that it's slow, that's just the deliverables. But I don't know off the top of my head the payment schedule of the 171 contracts that I have on that list. But we can work closely with program when we come back to BFA next time to really go through any kind of like program stuff that might be happening, because that's outside of my normal vision. Did that answer some of it a little bit?
Yes, that's very
does.
helpful.
And again, I'll go back to Commissioner Palmano and see what she has to say about that.
No, it's fine, and I look forward to the deeper dive as well. But thank you. for highlighting.
Other questions from commissioners online? All right. I just want to go back to, I think I recall this correctly, as you were talking about personnel and the projected variance or savings in the personnel category. I assume that some of that variance or savings is due to vacancies and positions unfilled?
That is what it's due to, exactly, right.
Exactly. Given the other increases in benefits and other areas related to personnel, I assume that.
The other thing, when we get the budget for positions, I believe they budget them, we're awarded money, sort of a mid-level for a salary range, but we've brought in lately, especially, a lot of staff that are new to state service. When you're new to state service, the default is you start at the bottom of the salary range. So some of it also has to do with newer to state service staff. Most of it is vacancies, especially higher level vacancies.
Okay.
They get paid more.
And again, that positive variance, you said that most of that money will be spent at the end of the year, given some of the unique kind of circumstance that you described. For example, you talked about bless you, Dave. You talked about the payroll system update and the expected additional expense associated with the payroll system update that the state of California is adopting and that we don't know. And so as we go forward in the deeper dive regarding Commissioner Palmano's questions, if you could just help me to appreciate and again, it's not a lot of money, but as I recall, it's about $1 million right now in terms of the variance.
For the salary, but then when you take into account some of the investments we've done with that money, it's $461,000.
The total variance.
Yeah, but yeah.
Yes, and so that implies again that some of the personnel positive variance has already been applied.
That's correct.
To other areas where we are underspent, and I just want to make sure that where the expense is more than we have budgeted it.
And that's typically because we know we have the extra money, something comes up that we didn't foresee at the beginning of the year, didn't put money aside for. Hey, we've got some extra money, if it's going to be for translation of something that's going to help people, it's like, yeah, let's go ahead.
Okay, very good. Thank you for walking us through that and just making sure that people in the audience understood that while we had this variance in personnel, some of it's already been encumbered.
Yeah.
Okay.
That's correct.
All right.
And then if anybody would like me to round the numbers up to maybe like the thousands in the future, you can tell me and I will be happy to do that. If not, if you want to keep it down to the dollar, I could do that too. But, you just let me know.
I stay to the dollar. I think that we get into all kinds of other issues when you start rounding up or down. And then I would also add that, and just in terms of the presentation going forward, it might be helpful if commissioners want to ask questions that we pause you, because that's so much information, so that we can maybe pause to ask questions for clarification. But that's something that I'm sure we'll have to think about going forward and what the implications are for public comment.
That's a great note.
Yes.
Making it now.
Yes, because again, there was a lot of information there. As we get ready to transition to public comment, if there are no other comments from commissioners. All right. Cody, can you lead us into public comment?
Thank you, Chair. At this time, members of the public may request to make public comment. Let's see. First, we'll hear in-room comments. When your name is called, please proceed to the podium to make your comment. There's two in-room comments. First up, we have Sarahi.
Is it for the
Sorry,
next
I
item,
guess
Cody?
that is for the next one. So I don't think we have any public comment
Okay.
for this.
No, you didn't. You built this up. You did such a great job. Thank you so. All right. All right. Thank you. Thank you, Lauren. All right. Yeah, you can click. And this is up and down. Okay. For agenda item 6, sustainable funding concepts. Now, for those of you who were in it, who attended the commission meeting on January 22nd, you may recall that there were commissioners who expressed interest in continuing the discussion to explore and better understand the potential for identifying financing strategies and alternative funding models that may be leveraged to support the stability and sustainability of behavioral health services and supports in California. As such, Commissioner Carnevale and I will provide a presentation on sustainable funding concepts, engaging commissioners and stakeholders in discussion to ensure that there is a clarity of understanding on our part, and with the goal of informing the development of a proposal that could be submitted for future consideration at a program advisory committee and client, family, and community inclusion, lived experience, and diversity advisory committee. At this time, I'm going to ask Commissioner Carnevale to please unmute his microphone. Thank you, Commissioner Carnevale. And we'll begin the slide presentation. And I believe our executive director is going to assist me with the slides. All right. All right, overview of the Institute of Sustainable Finance concept. Next slide. Today's discussion focuses on the development of a concept for an Institute of Sustainable Finance. The goal of the discussion is to determine if the concept is a good idea to move forward to develop into a proposal. If yes, then input will be gathered from BFA committee members and stakeholders on what information should be included in the ISF proposal, which would then move through the commissioner's established committee vetting process. If no, the discussions on the ISF proposal would conclude. If or once the ISF concept is fully developed into a proposal, the fully developed proposal would be processed through the commission's vetting process as outlined in the committee charters. Specifically, it would first be presented to the Program Advisory Committee and Client, Family, and Community Inclusion, Lived Experience, and Diversity Advisory Committee. The PAC and CFC would then be presented with a vote of approval to move the ISF proposal to the Budget Fiscal Advisory Committee, us, for funding allocation recommendation. The BFA committee would then make a recommendation to support or oppose advancing the ISF proposal to the full commission for approval. The core problem, unstable county behavioral health funding. California's county behavioral health system depends on multiple funding sources that fluctuate year to year. Major funding streams include 1991 realignment, 2011 realignment, Behavioral Health Services Act, grant and local initiatives, federal and Medicaid matching funds. This volatility makes long-term planning difficult for counties, providers, hospitals, community-based organizations, and state agencies. Most importantly, inconsistent funding disrupts care for individuals with the highest behavioral health needs. A proposed solution, the established a dedicated financing strategy capability with commission oversight. Purpose is to reduce funding instability and to build stable long-term long-term pathways to fund California's county behavioral health system. I'm going to pause and let you just again read the remainder of that slide. That line, excuse me. Core functions of the ISF: map and quantify funding volatility, model return on investment for individuals served by the public behavioral health system, including the BHSA priority populations, evaluate financing mechanisms, design pilot public-private partnership structures. Next slide. I don't think I have to tell you that. You're doing great. What would the Institute of Sustainable Financing do? It would answer practical questions like, what are the historical funding levels and why are they unstable? How can California attract and responsibly use private or philanthropic investments without putting public dollars at risk? What public behavioral health services are being funded year to year? What are the most effective programs to invest in for long-term outcomes? What financing tools could help build capacity faster, like clinics and housing supports, crisis services, and workforce expansion? What is the potential for public behavioral health funding? The ISF could help California move from short-term spending to long-term financing. The shift could unlock tools such as bond financing, public-private partnerships, blended finance, revolving investment funds, credit enhancement strategies that reduce risk and attract outside capital. What could this mean to the public? If well done, it could mean more crisis stabilization sites. Again, this is a repeat of what was said a little bit earlier, so I'll use an economy of words here. More outpatient clinics, mobile crisis, expanded mobile crisis response, workforce capacity, consistent treatment access, less program churn where funding changes, better outcomes for people with serious mental illness. Serious mental illness, substance use disorders, and co-occurring conditions. There's two project phases in this sort of concept discussion. Phase one, the planning phase, defining the deliverables, reporting requirements, and what government gates need to be in place. And Steve will say a little bit more about the definition of gates if you have questions about that. Phase two, implementation phase. Pilot projects, including financing structure options, procurement approaches, risk mitigation strategies, and readiness criteria. What would phase one potentially deliver? A statewide baseline measurement framework, California's specific return on investment models, financing pathways analysis, including bond and blended finance options, clear governance and reporting structure, a decision-ready phase two implementation plan within 6 to 9 months. Why this is a strategic investment. It strengthens accountability and fiscal discipline. It reduces execution risks for large-scale capital deployment, positions the Commission to responsibly mobilize future capital, transforms innovation funding from grant making into a structured capital strategy. Yes. Why the ISF concept matters now. Prop 1 has changed the authority and expectations of the Commission, allowing for continued innovation to strengthen California's behavioral health system. And ISF, an Institute of Sustainable Finance, could provide leadership to ensure that funding generated for county behavioral health creates opportunities for sustained, meaningful impact. Without such a funding strategy without such a funding strategy and associated infrastructure, even well-intended investments risk short-term impact. What success looks like: a California-specific financing strategy backed by evidence, a statewide measurement and capital decision-making framework, implementation-ready pilot financing models, scalable pathways to leverage additional public, philanthropic, and private capital, reducing funding by volatility for high-needs behavioral health populations. Again, for our discussion today, is the purpose and opportunity of the ISF concept clear? What, if any, questions or observations would help clarify the ISF concept and strengthen a shared understanding among commissioners and stakeholders? Is the ISF concept a good idea? If yes, what components, principles, or focus areas should be included in an ISF proposal to ensure it is effective, credible, and aligned with the Commission's and community's values? And a very important line there. Again, any concept that would go forward would have to become a proposal and would be vetted through the already identified Commission process. What are your additional questions and considerations? And we'd love to always solicit written feedback after this meeting to inform the ISF concept. Please provide that via email to the CBH by Friday, March 20th at oac.ca.gov. Thank you very much. And please, again, if I stumbled over it, remember I said at the beginning, I'm experiencing a little bit of a vision issue, which I hope to be corrected here very soon. With that, I'll ask again Commissioner Carnevale if you wanted to make any additional comments.
Well, there's a lot there, and I've been making comments along these lines at many meetings over the last 3 years, so I don't want to be redundant about that or what you've said. I guess I would just share a conversation I had this morning with Susan Ellenberg, who's the president of the Board of Supervisors of Santa Clara County, and she just got elected to be the president of CSAC. And, you know, she said basically in so many words that Prop 1 has taken away half of their money, and it was supposed to come back in the form of the housing, but all of that money is going to in other directions, and so they don't know what to do. And, you know, my answer to that was, well, that process has already happened. I don't know what we're going to do about that, but what I do know is that the entire system of finance around behavioral health, and by the way, the entire healthcare system, this is really a sub problem of a bigger problem, but the entire mental health system is not structured financially correctly, and nobody is getting enough money to serve their needs across the board. And so I think the commission in its position to be able to determine and offer and understand catalytic transformative ideas can take this opportunity to look at this problem at a system level and come back with some serious ideas that the state of California is not pursuing, nor is anybody else, by the way. I just came back last week from a global mental health conference, and everybody is talking about this problem. And frankly, they're all looking at California because we lead the world in many of these areas, and we have one of the largest economies, and they're looking to us to solve these problems. So I just think this is a unique moment in time where the commission can step up and help the world take mental health more seriously.
Thank you, Commissioner Carnavale. At this time, I'd invite commissioners to offer comments or ask questions. Thank you.
Oh, I
Commissioner
have a question. Go ahead. I'm not sure.
Commissioner Palmano.
Okay, so thank you for the presentation, Commissioner. I am just trying to wrap this presentation and what we're trying to accomplish here. So this really is a proposal. It has a phase one and phase two. I think I have a less of understanding of the phase two. So really, it's like this is like a big report. The phase one would look at really is it more like funding gaps where we are right now? Um, and then, so sorry, I'm looking at the slides on my thing. So phase one really would be a landscape. Maybe that is a better word of where behavioral health financing is, delivery of services, all that good stuff. Am I getting that right? And then what is the phase two of this project? What are the options to improve the phase one report, which is the landscape, so that we could improve the financing of behavioral health? Is that how I should think about this proposal?
Well, two things. I'm going to answer the first part of the question, and I'll ask Steve to answer the second part. The first, I want to really emphasize the word concept. This is a concept. It's not a proposal. And I know that that's important to stakeholders. The proposal would come later. The concept today is to do, yes, the phase one would be before we could even get to phase one, we'd have to develop a proposal that would include a phase one and phase two. In the proposal, as I appreciate this, there would be a landscape analysis. Now I will transition to Commissioner Carnavale.
Yes, landscape analysis is certainly part of it. That's the beginning of it, but then it extends into the issues around data and measurement and standards, and then it extends into thinking about new and innovative structures that could be deployed in order to radically expand the amount of money available. So as I envision it, the concept would be to determine the feasibility that would go to phase one, that would then scope all that out, and I would hope and expect phase two to actually be implementation, moving to implement. It's not, the objective isn't just to create a report, it's actually to create a process that leads to actual engagement with the state and other stakeholders to create new sustainable finance strategies and mechanisms that actually expand the money. So I would hope this would lead to real action, not just a report, that we're talking about.
Got it. So it's more like a master plan on behavioral health financing, really. I think that the concept is really good. We need some level of analysis, I think, especially on the landscape where we're at. I think what would probably be more difficult is the latter part, if this concept becomes a proposal, which is the phase two, because if we want to implement, and I'm just thinking out loud now, commissioners, implement some of these proposals, obviously we would need money as well. And I also wonder so I'll leave it at that. I think it's a novel approach to addressing a big problem that we have, not just in behavioral health, but also in overall, like you said, healthcare. We did a lot of report when we had single payer bills, so in the legislature. So I just envision I'm not saying that we need a single payer. Maybe we do in behavioral health, but um, that's my personal opinion, not attributed to my employer or anything. But really, this, um, but I think that um, the challenge would be the if there are things that ought to be implemented as part of the proposal. I think that's where the bigger discussion would be. But I think having again a landscape analysis is very helpful, at least for a lot of us, I think.
Well, let me just double down on that. I've been saying since I joined this commission, we don't even know the size of the problem. We've gotten so used to not having enough money, to not solving enough problems. We just live with that and then wait for the next day to find out what else is going to be cut. And that's when we've gotten used to that. That is not the standard we accept in other healthcare practices, but we do in mental health, and that's just wrong. And again, that's not just in California, that's actually a global problem. And so, but it's hard to understand. I live in the world of finance mechanisms, and if you don't understand that world or you don't know what we're thinking about, it's hard to even understand. But there are various financial mechanisms and strategies that are deployed in other fields that we can take advantage of. We just aren't. And that's part of this. We're not going to reinvent things that have never happened before. They just haven't happened in mental health.
Thank you. Mr. Gordon.
Thank you. First of all, I wondered, do we have a copy of this presentation that we could have? You don't have it on yours either? I don't think it's in. Anyway, I think this would be a very, very smart thing to do, because it's true. We don't have a mechanism for even understanding the progression of mental illness and when it makes the most sense to intervene. So in my experience with the commission and just watching what goes on, we intervene way too late and take on problems that have been brewing for years and years and years and were predictably brewing, but we didn't make any intervention at an earlier point when it would have either taken care of the problem or at least kept it from becoming worse. So let me give you some concrete examples of this. I think research would be very, very important to find out why we are not doing more in the early years, the 0 to 5 years, when certain conditions are developing. For example, autism. Autism is a whole spectrum of conditions which we're not necessarily doing anything with at the earliest stages, nor are we connecting any of it to, does this produce behavioral health issues? What other circumstances produce behavioral health issues for young people? So, for example, we know if there's instability in the family, if young people go into foster care, that creates a whole different setting for them, which is trying and potentially would require some behavioral health type interventions, or at least something to stabilize their conception of where they are and how they're doing, and all of that. Child abuse and all of those sorts of things. Those things are likely to produce behavioral health problems down the road, yet we don't have a systematic way of knowing what could be saved if we started at that point, or what it would cost us to do it at that point, rather than waiting till we have a very serious problem down the road. We don't have any data on that, and from what I've seen working in the school system for a long time, there are so many kids for whom the family stigma to even come forward to talk about behavioral health, mental health problems in the early years would be problematic. So anyway, long story short, my observation is that we don't have a basis for when to intervene or how to intervene, but it makes only common sense that you should intervene much earlier than we do. And secondly, we know that stigma and not coming forward and not trusting the mental health system is a barrier, and we also know that access is a barrier to many of our families for getting services in the first place, and particularly if they have young kids, they don't associate necessarily behavioral health problems with young kids because we haven't made that a priority to put on the table the availability of those kinds of services. So I think we can learn a lot more from a landscape analysis or some deep digging into the research to find out, are there markers that would say, okay, yes, it definitely makes good sense to intervene much earlier. And so I think this would be well worth it. I also think that what we're doing now is, and this has been my experience, is we in our work to try to correct these issues, we favor one-time funds, a one-time grant. And I can tell you how many times people have come to me over the years and said, wow, that program was great for the young people in middle school or high school or whatever. What happened to it? Well, we say the money ran out, and we didn't do anything to figure out, since the money ran out, did we get something out of the program that would have argued to continue spending the money? So I think getting a level set of where we are on this, it would be very, very fruitful and very, very helpful in resetting both our view of the problem and our view of what interventions and expenditures would make good sense and at what point. Because I can tell you, we are doing next to nothing in the first 6 to 10 years of children's lives. And keep in mind now, in California, young people are starting school at age 4. Transitional kindergarten is now available. It's waiting for us, and it is funded. Mm-hmm. So anyhow, I think, thank you, committee members, for putting this together. I will enjoy talking with some of my colleagues about this proposal.
Again, I just want to friendly edit to commissioners. This is a concept. It's not a proposal, and that's an important distinction. I know that I may hear that it was a proposal. No, it's a concept that has to be developed into a proposal. That said, any other commissioners online or in the room who would like to make any additional comments?
Question: what resources is going to be needed for this concept to get past being a concept?
Again, that's unclear at this point, Javon. Great question. Commissioner Wilkes, excuse me. When you get to know people, you call them by your first name. And so what's happened with in the relationship I have with Commissioner Palmano and Commissioner Wilkes is I've gotten to know them. So pardon the informality. That would be part of a proposal and potential funding, and that would be certainly something that the BFA would have to consider. We've made it very clear this is a concept, and so there are no potential funding ideas associated with this. I know that we had some discussion at our last commission meeting about potential funding. That did not go forward, and certainly it will continue to go forward as voted on by the entire commission. And that's clear. I want to make that very clear to everybody in the audience and in the room. And that's, again, the Innovation Fund is as was voted on. That said, We'll come back with the proposal that will include potential funding ideas. That's a question that's not been answered.
One more question.
Sure.
Could
Or two.
could someone put this concept as part of the innovation funding? Say someone not here on this council or discussed here decided to work this into their program. Could that be a part of their innovation funding proposal?
Well, one of the things that staff has informed us is that yes, this concept could potentially become an innovation proposal that then would have to be vetted and voted on by the PAC, by the CFC, and then by us, and then by the larger commission. But it is not there yet. This is just a concept. And if it was a concept that was not again eligible for innovation funding, we would have to look at other sources of funding to potentially fund the proposal. So it could go the other direction as well. I want to make sure that that's clear.
Well, just a point. This is Brenda Greatlish. Just wanted to make sure that it would be competitive procurement processes.
Yes, absolutely. Consistent with the commission's current procurement process. Absolutely.
One more burning question.
Okay.
From the concept of it, and of course, always thinking innovatively, especially as it pertains to our young people and the data to which they become part of the hotspots for when it comes to social determinants of health and the CalAIM innovation and DHCS's responsibility for healthcare in general, even behavioral healthcare. When it comes to this concept, is it also to figure out how to maximize um, and generate dollars from what is available funding wise under BHSOAC funds?
I'll ask Commissioner Carnevale to answer that question.
Well, we're not envisioning that we're trying to raise money for the commission itself. The commission is trying to change the whole system. So to the extent that changes things within, DHCS or whatever remains to be seen. I think the idea is that the pot grows larger as a result of this, and where it ends up in the system is determined somewhere downstream based on, a variety of variables. So I wouldn't worry too much at this moment where it is. The bigger trick here is how do we bring that additional money in? How do we create mechanisms that can grow the pie to deliver the services that people need?
And again, Commissioner Carnevale, by grow the pie, you mean return on investment, because if we establish an Institute of Sustainable Finance, albeit via a proposal that's voted on by the commission, there is an expectation that there would be some mechanism to really monitor return on investment and ensure that the strategies, there's no guarantees in the world, but that the strategies are designed to address some of the things that Commissioner Palmano and Commissioner Gordon described, and that is, A, that we get data, and B, that we not have programs that are dependent on one-time only grant funding, and that when the grant funding ends, good programs go away.
I think Commissioner Gordon brought up this idea of investing early in order to solve problems downstream. One of many reasons that hasn't happened previously is it's been difficult to measure those outcomes, and so people say, well, we can't figure out an ROI, and so we can't depend on it. But the fact that we're in this situation isn't because people are trying to be bad. It's because the world, the science, the understanding of our healthcare has changed, and it's really improved a lot, particularly with relationship to mental health and the brain. And we understand a lot more, literally in the last 5 or 10 years, that we didn't understand previously. And so that creates an opportunity. And now there are a lot of new technologies being deployed which can actually measure outcomes that we never could measure before. So it creates a potential system to actually calculate returns on investment. And what that means is there's two kinds of money you can spend. You can spend money on expenses, to buy ice cream, or you can spend money on things that are going to save money downstream. And all of us do, some of both of those. And we don't distinguish much in government between one and the other, but we're now in a world where we can, and we're advocating that in the case of mental health, we should. But it happens all the time in the rest of the healthcare system. We have entire programs to try to get people to monitor and control their blood glucose so they don't have diabetes, or so that their diabetes does not grow worse. That's a great example of earlier prevention and intervention. We don't have a lot of that here in mental health. So we're trying to get to that kind of a system.
Commissioner Gordon?
Just one other comment. Right now, the state has invested along the lines of 10 or so billions of dollars in something called the Community Schools Program. So probably over 1,000 schools around the state have been given grants to try out different things to add to their repertoire in the interest of engaging the community and involving the community. Many of them may have made investments in things like behavioral health or other kinds of social emotional learning. And we have an opportunity to learn, have those things been effective, because the money is going to run out for the community school programs. And if it runs out, all of that probably stops. But if we find that there's some correlation between doing that and improving student mental health, that's good information to have, because we already spent the billions of dollars.
Absolutely. CYBHI goes away. I think it's this June. And so it was wonderful. And now everybody's going to wonder, why was it so wonderful? Why didn't it continue? Those are exactly the kind of issues we have to take on.
All right. Are there any other commissioner comments?
Oh, I do. I think this reminds me of what we did with the California Institute of Regenerative Medicine. Of course, that was done by proposition and billions of dollars, and they have similar provisions on return on investment. So I think I have the same funding concerns like Commissioner Wilkes, and but I think that the concept, or I suppose turning this into a proposal so we could see the parameters, I think of what we are expected to look at or to do or to see would be helpful. One thing though is once this proposal is in black and white, I would assume that Sandra and Brenda would be able to let us know which, if any, would require additional legislative approval, correct? Okay,
That's correct.
thank you.
As it said in, I think, the second or third slide of the deck is the process, so that, if this concept turns into if the concept turns into an approval, then the next step would be to the Program Advisory Committee.
I'll add just a closing comment. I have been in behavioral health for now 4 decades, and I said this at the commission meeting that Prop 63, which is now Prop 1, was a concept. There was people in the room like Rose King, but again, the primary author, Rusty Seelix, and the carrier of the bill of that proposition, Daryl Steinberg, and they came to many of us and said, "Here's a concept." We had just worked on a nickel for mental health tax, and we knew that behavioral health was not as much of a priority in the state from the perspective of one as I would have liked it to be. And that began the genesis of what is today Prop 63 and Prop 1. We have not presented a proposal, we presented a concept that, again, wanting to get feedback from commissioners on this committee and from stakeholders, members of the public, because commissioners said at the last meeting, hey, talk about this. And again, I feel some sense of responsibility to carry that conversation forward, albeit as a concept, with the hope that one day we'll be talking about an Institute of Sustainable Funding or Finance in the same way that I could have never envisioned that Prop 63, which is now Prop 1, is today. That's the hope. And that it would benefit constituents across the state of California, individuals with behavioral health needs across the state of California, through what I would hope would be a very comprehensive array of services that, yes, my hope is that the commission has a big part of identifying at the genesis point and then helping to create. That said, I'll pause with no other commissioner comments, and I will ask Cody to please go ahead to public comment.
All right, thank you. Sorry, got ahead of myself last time. So we got a couple in-room public comments. First up, we have Sarahi.
Hello. Okay, perfect. Hi, my name is Sarai, she, her pronouns. I'm an MSW intern with Safe Passages and a second-year MSW student at UC Berkeley. Thank you, Commissioners Carnevale and Rowlett, for the presentation and y'all's work on it. My first point is relating to the just the process in which the concept was presented. From my understanding, like per the committee charters, shouldn't this type of convo or just like concept be initiated first in the program advisory committee? I'm just curious as to why it was started here first. And then secondly, as was mentioned, like we all know that public funding is always in flux. Perhaps it's just an effect of a system that was designed that way, but that's a convo for another day. But that being said, like I think we all know that we need funding to be able to do the work that we want to do, but I worry about the process for like working with private like firms, particularly because a lot of times they're very much like profit driven. And so in our work that's like so community centered and like people powered, I just worry that that could impact the like integrity of the work of like our work and like the commission. So I just like hope that there's some kind of like guardrails or something in the future to like prevent any type of like agency or like AI, whatever, like management system to come in whose like intentions aren't as pure as they should be. Thank you.
Thank you very much. Next up, we have Ash.
Test. Hi, my name is Ash, they, them pronouns. And I'm also with Safe Passages as a second-year MSW intern. Thank you so much for the presentation. It was very thorough. I want to echo just a little bit about the like steps and the fact that it's been repeatedly mistaken as a proposal because it does resemble a proposal quite heavily. But I appreciate the reframing around it being a concept because there is more things to figure out. Since it's an early concept discussion, I just want to take a moment to raise guardrails before anything becomes structured, because when public entities move into capital strategy and blended finance models, decision-making dynamics can shift towards centering financial structuring priorities. So we simply ask that the Commission clearly articulate how public interest protections will be preserved as the evolution occurs. And if this concept moves forward into a proposal phase, we respectfully ask that the Commission build in from the outset the following. Clear procurement safeguards for any external expertise, competitive bidding and public scopes of work, strong disclosure and recusal standards for financing-related decisions, and plain language reporting so community stakeholders can meaningfully understand and engage with the framework before it becomes embedded. So we're rooting for the exploration of sustainable funding strategies, and we're also asking for transparency and accessibility, and that's foundational from the beginning. Thank you.
I wanted to, before we go into online public comment, to just speak to a couple of things that one of the questions that I explored as a chair was the raising of this concept at the BFA committee. And it was, again, Sandra, you could please correct me, my understanding that the charter allowed us to raise the concept at the, and if you could speak to that, Sandra.
Absolutely, and it's when it becomes a formalized proposal that it needs to go. And then we've made it very clear that if this concept were to develop and grow at this point, then it would be presented and it would enter the formal committee process, which would go to PAC, CFC, BFA again for funding, and then the full commission.
Second, I wanted to just reiterate the importance of, if you could please email all of your recommendations to staff. I was listening and taking note. Please make sure that you email all of your comments to staff, because they certainly will be taken into consideration, and that is in advance of listening to online public comment, which I will now transition. So thank you for those of you who are in the room. Now we'll transition to online public comment. Cody?
Thank you, Chair. We currently just have one public comment. Joel, please go ahead.
Great, thank you so much. And again, appreciations to all of you for the work that you're doing. You know, growing up, I was taught that if it walks like a duck, and it talks like a duck, and it looks like a duck, it's probably a duck. And you will recall that the notions of this scheme were really introduced at last month's meeting of the full commission. And to many, it appeared to be a poorly developed plan that lacked any clarity and specifics. The individual who presented it was not even in attendance. Following a lengthy discussion in which a majority of the commissioners and many of the community members who spoke raised serious concerns, the item was rejected for funding for this year. I recall stating at the time that were this to have been a proposal brought before this body for funding, it would have easily been rejected. Yet here we are again, right? I'm left wondering why it is that there's so much passion around this particular topic. With respect and a desire for full transparency, I want to ensure that members of the committee are aware that the individual who has pushed this scheme is a founding partner of an early stage venture firm, quote, that seeks to support brain health innovations. I'll also point out that the strategic advisor for this for-profit entity is the former executive director of this body, who recently resigned under some pretty cloudy circumstances. I submit to you that this, quote, concept represents a significant and potentially damaging to the entire commission conflict of interest. I would assert that committee members should be skeptical of this dubious and still vague, quote, concept. I would like to be able to assume positive intent, but folks, I see a duck. Thank you.
Thank you, Joel. We have one more public comment from Laurel. Please go ahead.
Good afternoon. Laurel Ben-Hamida with Mass Social Services Foundation and REMCO, the Reducing Mental Health Disparities Coalition. This came rather late in my mailbox yesterday, and I've been trying to wrap my head around it. I think the first thing that got me was the use of the word institute. I really don't understand what you mean by institute. So, of course, I looked it up, and sure enough, it means an organization founded for a particular purpose. Well, are you planning to set up an institute with a 10-year life, a 5-year life? Are you going to bring in health financing and economists, health financing economists and specialists to staff this institute? It sounds expensive to me, and maybe will add to the confusion that we have because we separate mental health and behavioral health from physical health. So I don't want to dampen your enthusiasm, but I think you've made some steps forward in the sense of this presentation is after the word institute, it's more understandable, although it has a lot of jargon from an area that we're not used to in mental health. So that financing world that Commissioner Carnevale talked about. Maybe setting up a subcommittee, that doesn't cost anything, bringing in some health economists from other state agencies, that wouldn't cost anything, except time, of course, to explore this until we have a new governor and we see how Prop 1 rolls out and what it looks like in the first year. Those are just some off-the-cuff remarks with not many hours to take a look at this. I do know I went to the Steinberg conference a couple of weeks ago, and it was full of information. It was great for information. But at the end of it, when I was reflecting on the state of our system, I was so frustrated. And so I just asked ChatGPT, take a state like California with its diversity and so on and so forth, what would the ideal mental health care system be? And any of you can do that, and you'll probably get the same answer. Mine started with Finland and followed with Great Britain. So maybe that's a way to go, and that didn't cost much. Anyway, I'm glad that you understand that we don't want part of the 20 million to vote it to this. And perhaps just a subcommittee to explore with no cost might be useful. Thank you. And we're supposed to have a conversation, by the way, which we didn't have at the program committee. So if anyone wants to answer me, I'd love to have a conversation. That was what the promise was.
Thank you, Laurel. We have a couple more people who have raised their hands. Eva, please go ahead.
Thank you. Yes, I wanted to, I'm the president of Whole Systems Learning. We are part of the African American Hub for CRDP. And we are also concerned about this proposal. And I guess the first concern is whether it is going to be funded by innovation dollars. And I may have missed the part where that was discussed, but I certainly think that it would be a misuse of public funds to spend money on what would turn out to be a private venture or a for-profit. I think we also need to be really clear if this is going to involve the private sector as to who are going to be the ultimate beneficiaries of this. Is it going to be the people, or is it going to be the financial interests that are going to be making the money off of this? Because I think that we have to be very careful to be sure that the intended beneficiaries are the actual beneficiaries. Um, the other thing, I think that it would be a mistake to do anything in the private sector without the full participation of community-based organizations. And there are many of us, myself included, that are financially sophisticated enough to be able to effectively participate in these kinds of discussions. So I think that there can be a lot of crossover between the financial worlds that are contemplated here and the community-based worlds in terms of working together should it come to that. Thank you.
Thank you. And our last public comment comes from Alex. Please go ahead.
Hi, thank you. Thank you for the opportunity to provide a public comment on this topic. My name is Alex. I use they and he pronouns, and I'm also with the California Reducing Disparities Project. I work with the LGBTQ grantees in our project, and some of the aspects of what are being presented sound interesting. I understand the idea of like setting aside money and investing that to have more money or a more sustainable source of money in the future. That makes sense to me. A lot of the other information that is being presented is just like not really clear. It sounds vague and confusing. I think that it's also concerning, that there's been this like reorganization of funds from, Prop 63 to Prop 1, and there's a lot less money, for prevention in particular. And that's another form of investment, right? Is, preventing problems or addressing systemic inequalities that are existing, that are resulting in mental health impacts. And, taking $20 million out of this fund and taking it away from communities of color and LGBTQ communities who are like under attack by the federal government and who need access to care and resources right now, is just a pretty significant amount of money that could be going out to supporting communities like right away. And so I can appreciate the idea to like invest in the future and have sustainable funding, but I also think that that could come from a different source. It would be great if more people in this country believed in income redistribution and taxing the rich. Frankly, I'd like to see that, and that the money that you have all been allocated to go out to serving communities actually going to the community members that need that right away. Thank you.
All right, thank you. Those are all the public comments. Chair, back to you.
Thank you so much, and appreciate the public comment. I'm going to reiterate what was said at the beginning on a couple of occasions. As part of our ongoing commitment to transparency and collaboration, we want to ensure that information flows completely, seamlessly across all of the committees and to our stakeholders, members of the public. This concept and the discussion related to the concept is within the parameters of the charter, and consequently is a concept discussion. That's why there are no dollars allocated or no proposed encumbrance on any fund that the commission currently has oversight. It's a concept. And wanting to also acknowledge the importance of collaborating with the community and making sure that the community provides us with input around their appreciation of the concept. That, again, is impactful. We appreciate that. We appreciate your feedback. And I will make sure, as Brenda reminded me, that we follow through on our commitment to have ongoing discussion as it relates to.
Just talking about this, in our like we relaxed Bagley. Sorry,
you turn your mic.
Let me turn my mic on. So just in the sense that we've relaxed Bagley-Keene requirements on agendized items, so that did I say? Oh, I'm sorry. Robert's rules. Thank you.
We relaxed Robert's rules of order, not Bagley-Keene.
And I say my brain is thinking Robert's rules, but saying Bagley-Keene, I'm so used to saying that.
Somebody in the legislature's over there.
I know. Sorry, you guys. Sorry.
It's okay, Ross.
Deep breaths.
Commissioner Model.
No, sorry. We've relaxed Robert's rules so that we can have dialogue and conversation with our communities. So,
Yes.
As folks are talking, I think we've got some ideas on the table. So part of what was presented in the presentation was kind of trying to get some ideas on what are things to think about. So I've heard some ideas for some guardrails and different things that folks have asked you to consider, and Commissioner Carnevale to consider. And so didn't know if you wanted to spend a little time. We have a few more minutes left, engaging in dialogue with those and exchanging of ideas.
Well, certainly, again, I'll see if commissioners wanted to add any additional comments. I'll save my comments for last. I will say that I was also at the Steinberg convening, the Steinberg Institute convening. I had the opportunity to engage Laurel and look forward to following up on commitments that were discussed at that meeting, not related to the commission, but just related to making sure that our committees continue to function in a way that the public expects them to. And that's part of the goal today. Again, I'm saying it ad nauseum because it's important to everyone here. This is a concept. Your ideas, your suggestions related to guardrails, and related to return on investment of potentially utilizing public funds and the implications of that, all duly noted. Also, the constructive feedback related to conflicts of interest, duly noted. And we'll pay attention to that. But again, I'm going to now pause and see if there were other commissioner comments that based on what you've heard from our stakeholders, the public, the individuals that we're here, we are uniquely privileged to represent. If you have comments, commissioners online or in the room. And Steve, any comments?
Well, I would only say this. I would say that I really appreciate the dialogue. Understanding people's concerns helps me a lot. I would say that the vast majority of what was said, I'm in violent agreement with. And just to be clear about this, this is not to create a for-profit entity or an entity that anybody makes any money on. This is akin to, we have a mental health house, and we're trying to come up with a way to replumb that house in a way that the water flows through it more efficiently without leaking. That would be the analogy I'd use. That's all we're trying to do here. This is a little esoteric, but these are financial mechanisms. This isn't creating a new governance system or anything else. So I would fully expect and hope people are at the table, including some of the recommendations of bringing in national and even international people to the table.
Other comments from commissioners?
Are we supposed to are we voting on any motion today, Commissioner? No? Okay,
No.
I just wanted to clarify. Again, I've been working in healthcare for a long, long time. I see a lot of data on physical healthcare, but not a lot of analyses on landscape for behavioral health. And in as much as we could probably include commercial coverage also on the from concept to proposal, if we are going to really look at the landscape of behavioral health in California, I think we shouldn't just focus on county behavioral health, Medi-Cal, but also look at 50% of coverage for healthcare is commercial through commercial plans, and so I think again that would be helpful to have. I am comfortable with this concept, turning into specific proposals, because we're not really funding anything. We're just looking at things that could be considered, whether you like the idea or not, I think is what we're trying to get at. And I think it's high point for behavioral health. When you go to the California Healthcare Foundation website, you see a lot of insurance coverage data, on landscape, coverage gaps, affordability challenges, access barriers, all that good stuff. We don't have that in behavioral health. And whether we could do this project, I don't know. That's why we are turning this concept into a specific proposal, so we could see if it could be done.
Thank you, Commissioner. Other comments? One of the things that throughout my career, and I'll try to say this succinctly, I have noted the difference between and the language here will represent a period in which I've worked in the mental health as a community-based provider of services. But the notion of the specialty mental health system and the private or commercial system in behavioral health and the differences. And what I've always heard is this, that the specialty mental health system or the public system is more comprehensive, given its fragments, than the other system. Well, whether that's true or not, I don't know, and I don't want all the folks who are online and listening to this from the private sector to call me up and say, that's not true. What I have heard is that there are differences. And there's never been a clear landscape analysis to look at why and where we should begin to conform so that the system adheres to an established standard of care across again, I'm going to use that language, the specialty or the public system and the private system, so that people will know what to expect. And as the state of California, which is, again, I'm going to speak to what was said online, has a far larger economy than Great Britain or Finland, I believe was the two references. We should do better. We should do better. And what I'm hoping is that the concept would spur us forward to say, okay, bring back a proposal that represents an opportunity to really do better under, again, the auspices of the commission. So thank you for saying that. I was just reminded that it's 2:30. So that's my cue to say this. Thank you again, everybody, for coming to the commission meeting and being here today, and for your heartfelt comments and discussion. Yes, thank you, Brenda, for telling me to stop talking. This has been a thoughtful engagement, and I mean that sincerely. Yes, even your constructive feedback and your criticism, it's very thoughtful, very helpful. We expect to convene again in early April or early May, with the exact date to be announced soon. Please monitor your website and sign up for email updates. Stay informed about upcoming meetings and opportunities to get involved. With that, I will now adjourn our meeting. Thank you all for your time, insights, and commitment. We will continue to adhere 100% to Bagley-Keene. Thank you, Sandra. We look forward to continuing to discuss the Commission's initiatives and working together on this important effort. Have a wonderful day, and thank you.